You're listening to the Smart Policy Podcast, a production of the University of Tennessee's Institute for Public Service. If anyone has gotten a true bird's-eye view of the drug problem in the United States, it's someone like Special Agent Karl Colder of the U.S. Drug Enforcement Administration. From starting in Philadelphia when crack cocaine was the top concern, to overseeing the region containing West Virginia and D.C. when the opioid crisis progressed from prescription pills to heroin and fentanyl, finally directing the entire Department of Internal Affairs at the DEA, Special Agent Karl Colder has seen the whole drug trade up close and personally. In this conversation, he reflects on some of the changes and challenges experienced by law enforcement over the past 30 years.
Law enforcement has changed. Law enforcement now says, hey, we can't arrest our way out of this problem. What do? We have to team up with community. We're not programmed to deal with these things. Homelessness, mental health, substance use.
Now retired from the DEA, he works as a consultant, providing education and training to faith communities.
Guess what? Who's the first person somebody's going to go to when they're suffering? They're going to go to their minister.
And law enforcement organizations on evidence-based practices relating to addiction and mental health intervention.
If you're a detective and all you've seen is homicides for the last 3 years, what do you think is going on in the mind there?
A big focus of his work centers around improving such resources for law enforcement and first responders.
When you have an officer who's addicted to alcohol and everybody knows they have a drinking problem, but nobody says anything. There's all kinds of employee assistance programs that have to be utilized up front as opposed to after the damage is done.
Agent Colder has a lot of fascinating insights covering everything from the southern border to rural communities, from youth education to telehealth. His structural and systemic perspectives on what's happening with law enforcement are particularly interesting.
One of the things we see is the shift to other drugs, thinking that it's not associated with fentanyl. So, and the safety surrounding it. So those users are now saying, well, I don't want to deal with this fentanyl. I'll go back to methamphetamine. Well, the cartels know what we desire in terms of drug trafficking. Now, in places like Tennessee and Florida, you're now seeing more of the old way of making methamphetamine, and you have the mom and pop labs coming back just to be safe. And so now the Mexicans shift gears and the Colombians shift gears right along with us, okay? And with the demand.
That's actually really fascinating. I hadn't heard yet people turning to more homegrown meth to avoid fentanyl contamination just because it's such a huge issue.
We're seeing that now.
That's fascinating.
Yeah, but because of the laws, with pseudoephedrine, over-the-counter medications like that for production of methamphetamine, that
there's more tighter regulations.
Right, tighter regulations on that. But it still happens. We still see it.
Oh, that's interesting. A quick aside. You were talking about the cartels know what we want, and that reminded me of Mexican President López Obrador. He said that Americans need to focus more on reducing demand. I think there is something to be said about needing to reduce demand, but there's been a lot of talk about how the United States should handle what is clearly a lack of action. And some are even talking about special military operations and things like that. There's a wide range of things that people are talking about at the federal and local levels. I imagine in Texas there's quite a raging debate too. But I was just wondering if I could get your perspective on because this has been a pretty heated and contentious issue.
Yeah, well, there's different points of view on this. For one, you can't go into another country and control that country. They have a responsibility as well. So with, for example, the Drug Enforcement Administration, we do our best. We're in over 90 countries in abroad. And so when you see that and you have that reach, you're trying to assist host countries and nations in how they control it themselves. With that, you have corruption, you have all these things that, even foreign governments are dealing with.
Right.
The violence associated with that, with the cartels and the militia. So those are all the things that you worry about abroad. Having good relationships. There's an up and down with the Mexican government. So, and the trafficking patterns are changing, from Colombia, Mexico, and now Africa and all these other countries, where you're now having to shift gears and pay attention to. When we look at ourselves here in the United States, what do we do? How do we provide programs for those who are in recovery and have substance use disorders? How do we educate young people that, hey, a pill may not be the real pill. It may be fentanyl. Okay. So education, just awareness and talking about it here in our country, getting organizations involved, law enforcement for years now. I could say in the last decade or so, law enforcement has changed. Law enforcement now says, hey, we can't arrest our way out of this problem. What do? We have to team up with community. We have to do these things. And then on the other side, you have the issues in policing where, we haven't done a good job in terms of civil rights. So all these things come into play. And, you go into DEA headquarters and you see the walls, and you might want to take a visit to, because of the DEA museums there and that sort of thing. But they have walls of those who have died from overdoses throughout headquarters. So education. I do a lot of that work with faith-based organizations, because guess what? Who's the first person somebody's going to go to when they're suffering? They're going to go to their minister.
Yeah.
The parents are going to go there. The loved ones are all going to go to their priest to say that they have a loved one who's suffering.
Especially in a place like Tennessee, yeah.
Yeah. So how do we educate our ministers, our priests, to, what? You can't save the world by counseling. You have to know where your services are in your community. All right. There's more than one piece to this.
Yeah, I believe it's been called the everything problem,
Yeah,
which is a description I rather like.
the everything problem, and how do we deal with it?
Well, this coalition building and education that you're talking about, this has been a significant part of your more recent work.
Well, my consulting is very diverse, because one piece is to assist companies in their effort to get their data analytics into government law enforcement. And I had several contracts with Fortune 500 companies who are doing business with the government. They have technologies that are valuable to federal law enforcement and state and local law enforcement. So I try to facilitate those, contacts and collaborations with agency and business. And so that is one part of it. The second part of it is community engagement. Initially, it was the Episcopal Church. I'm a member of the Episcopal Church, and I questioned what we were doing as an Episcopal church in Virginia to help those who are suffering from substance use disorder. And that mushroomed into regional programs. And Bishop Curry at the national level decided that, hey, we need to do something nationally. And that was a great thing. And then I started getting contacts from other churches in conjunction with that. But the other thing that we also started doing, and this is where law enforcement comes in, because now there's also mental health associated with substance use disorder. And so how do we deal with that in law enforcement? Okay,
Right.
because we're not programmed to deal with these things. Homelessness, mental health, substance use. And then not only are we dealing with the epidemic, you have the stress with first responders dealing with COVID and substance use disorder. And they also have to take care of themselves.
Yeah.
So that's another message. We have a long way to go. We're still moving. We're doing well as a country to at least have identified our issues.
There are efforts to increase mental health first aid programs, not only to reach out to law enforcement themselves, but to provide more training to the officers to be able to respond. There have been efforts to have mixed unit response teams, alternative
Mm-hmm.
response teams that partner with social workers, psychologists, things like that. Do you think this is a good direction?
Oh, that's huge, because relationships solve problems.
Mm,
Okay, so if you have a good community relationship with mental health, first responders, faith-based organizations, and volunteers, all these things to help, go in outreach.
so, what do you think we've been getting right, and what do you think we've been getting wrong?
Controlling our borders. We have to find a way to do a better job of that. When you look at the border crossings, how many trucks and cars cross the border every day, it's like a parking lot, and then traffickers, they get smarter, they dig tunnels. We've seen all these things, and then establishing better relationships with countries that we don't have good relationships with. It causes them a problem too in terms of overdose and addiction. So how do we educate young people? And I'm really concerned about our young people understanding, hey, one experiment could cost you your life.
Like we've been talking about, there's mental health, there's homelessness, there's a lot of economic factors here. What do you think has been playing a role in the background in terms of stimulating our demand?
Services, what I saw in West Virginia, which is a sad thing. We have to decentralize service areas, okay, because they're all in the big cities, so to speak.
Right.
And now you have rural towns and cities that are suffering, and those people have to travel different places to get services. We had the panhandle of Martinsburg. They were traveling to Baltimore for services. And so when you have to travel that distance, you go and you get your methadone, you get your services, you get all those things. And guess what? You have to travel back home. So
You got to
what's
take off
going on your
work.
way back home? Drugs.
Right.
We have to ensure that these services are everywhere.
Like I think the median distance to medications for opioid use disorder clinic is something like 50 miles.
Right.
And telehealth has played a huge role in this. The pandemic came and opened up a lot of prescribing capabilities.
Right.
But now the DEA, I believe, is making recommendations and they're taking some open feedback now. They were going to shut down a lot of that. They were going to make recommendations shutting down the ability to prescribe without an in person visit on the first one.
Right. With
Uh,
Suboxone and all
right,
those different
exactly.
things. Yeah. Yeah.
But now they reconsidered and they're taking open feedback, and a lot of addiction medicine physicians are and providers are saying, no, hold up, this is saving lives. Let's take a minute and think about this. What do you think is happening there?
Well, you have to look at it when you're talking about Suboxone. HHS, they really deal with that because they put out the regulations to the doctors that the doctors have to abide by. But everybody thinks it's solely DEA.
Oh, I see.
Well, DEA has to really ensure that they're abiding by those regulations, and they it's like they're the middleman here.
Oh, and they're getting all the finger pointing, even though they're just saying,
Right. So
right.
you have to understand these things, and so DEA is just there to ensure that the process works well.
The drug enforcement, not drug legislation agency, right?
Right. Exactly. And that's what we're seeing in a lot of cities around the country. Their law enforcement gets that bad rap because they have to put out the fire that's created by these programs that aren't working well. Okay. And so, hey, that's why we need more training, because a lot of it is not just drugs, it's mental health.
Yeah, and if there's no services in those small towns like you're talking about, and the only way to respond is to have a cop put them in jail for a little bit, this is why we hear again and again and again from county mayors that, yeah, my county's largest mental health institution is our jail.
Right. And the other thing is larger cities have the capacity to have 24-hour programs. Well, the smaller rural towns, after 5 o'clock, everything shuts down.
Mm-hmm.
So where's the service? Law enforcement, first responders, the fire department, and the emergency room.
Oh,
Those are the
yeah.
services.
Emergency rooms are just getting slammed with this. Yeah.
Right. And before I became a DEA agent, I worked in basically not a halfway house, but a rehabilitation center.
Okay.
So I got to see that side of it. That was a 24-hour, 365-day of the year program. We were also a thermal shelter in the winter, having doors open to people. And then you have a number of transient people who come into these communities and they're told, hey, go to such and such city because they have the services. So now that city gets an influx of people coming into the community who need services. And the services aren't available if they come in at midnight.
And I'm thinking now about opioid abatement settlement money. Thinking about these small towns, a lot of them, sometimes there are whole counties that are only getting, some tens of thousands of dollars. There's a town in Tennessee that's only getting $18 over 18 years. What are they going to do? You can't hire a psychiatrist with that.
No, you see, so these people have to travel to Knoxville or whatever, So how do we bring services to the people?
What recommendations do you have for us?
Oh man, I mean, hey, and here's the thing: you create more jobs, but now you have to have people who want to live in these places, But you're creating income because now you have services in these places.
There's concerns about how these providers might get paid. Do you think we're talking about that element of it enough?
Yeah, well, that's another thing, Medicare, Medicaid, how that's being used in the process, all these benefits, and the sad thing that nobody really pays attention to is how incomes have been affected by this. Okay, because this has no face. Substance use has no face. Okay, it doesn't ask you whether you were rich at one time or you had a substantial income. It has destroyed families. It has destroyed the income of families.
I personally do think economics is inextricably linked with addiction.
It is. Everybody needs help now.
Yeah.
And I go even deeper now that I've been in, consulting. We have to get our young people into STEM programs. We have to enhance our knowledge in STEM, national security, cybersecurity. We have to get ourselves up to standards now. We're depending on others to perform these things for us. We need to be that premier nation who has it and has all the tools.
In closing, is there anything you'd like to add?
No, I'd like to thank you. And, just by happenstance, we happen to meet, and maybe we can do this again, focus on other topics. But at the end of the day, we're public servants. We want to make sure people are safe and healthy. I think that's the number one goal. I've met tremendous people in law enforcement and throughout my career, even as a police chief. And it's one of those professions where it's a broad brush effect.
Mm.
And we have to realize that, but at the same time understanding that it's a broad brush, because what happens in Philadelphia trickles down into Virginia or whatever, in terms of policing. And so we've had a few bad incidents that, as we climb and try to fix things, these things happen, and it just pulls law enforcement down again.
Mm.
And so and that's a sad thing, because there are so many hardworking first responders and people in law enforcement that are doing great things, and it's overshadowed by the one or two things,
Right.
so I just want to leave with that. Take care of your first responders as well. They're people just like anybody else. They don't have the Superman logo on their chest. They think they do at times, and that leads to stress.
Yeah.
Law enforcement, we have the same problems that everybody else has,
Yeah.
family, relationships, all these other things that we have. And, we have elderly parents that we have to take care of. We have female and male officers who have to take care of their families, just like everybody else. And they see bad things every day. So where are the programs for our first responders, our firemen? And one of the great things that they have at the Huntington Police Department, we had there, is a Compass program. And that program was geared towards the health and wellness of first responders, and in particular the Huntington Police Department and Huntington Fire Department, and just a place to go for learning how to prepare a healthy meal, learning how to take care of your body, having physicians on staff, mental health care, checkup, chiropractic stuff,
Yeah.
these are the things when you're sitting in the car all day. If you're a detective and all you've seen is homicides for the last 3 years, what do you think is going on in the mind there?
Yeah.
These are things, and it's no excuse for what happens, but when you have an officer who's addicted to alcohol, all right, and everybody knows they have a drinking problem, but nobody says anything. So it's up to management to understand these things. There's all kinds of employee assistance programs that have to be utilized up front, as opposed to after the damage is done.
Yeah.
And we see that all the time, that, hey, these programs aren't a get out of jail free card or a save my job program.
Right.
We have to identify these issues And then our veterans, okay? We talk about our veterans, 25 a day committing suicide. Uh, these are the issues. And guess what? How many reservists are in law enforcement?
Quite a lot, I'd imagine.
Quite a lot. And a lot of them go through traumatic situations when they're on duty with the military, and then they come home and there's no decompression. They go right back into their law enforcement job. But there's great people in law enforcement. Let's not take that away. There's people. There's law enforcement working day and night to get a job done, and we just suffer from some of the bad things that happen.
Suffering alongside all the rest of us. Very well said. Karl, it was a true pleasure talking to you. Like you said, a happenstance, a family connection led to a really, really wonderful conversation, and just by pure coincidence. So you just got to love that kind of thing.
Yeah, it's amazing. Thank you, and what you do is important too, because you open the ears and the eyes to a problem or issues, and that's good, and it's really unbiased, and I like that part of it. We have to look at the facts. There's not one problem that has one thing responsible for it.
Right.
Okay. And so, we have to look at ourselves and really come up with solutions.
Well, Special Agent Karl Colder, it was a true pleasure talking to you, and we'll definitely be having you back on the Smart Policy Podcast.
Okay. Thank you.
For more episodes on in-depth discussions on Tennessee policies related to substance use disorder by a range of local experts, please subscribe to us wherever you get podcasts and visit our website at smart.tennessee.edu. I'm Jeremy Corvellis. Thank you for listening, and see you next month.